Doc, I can't tell you, all my joint pain has gone away. And I started this hormone replacement therapy. Now I do not have any pain anymore. Are your joints suddenly aching now that you've hit menopause or even perimenopause? Today, I'll explain why joint pain becomes more common during menopause and what's considered normal versus something that you should be worried about. I'm Dr. Bhanusali, and I have helped thousands of women navigate joint pain. Recently, a couple of my patients experienced significant joint relief just by addressing their menopause symptoms. But it's not always so straightforward. More on their stories later on. Let's dive in. Why does joint pain happen around menopause? Because over half of women experience joint pain as they approach it. And the reason, there are lots of theories out there, but one of the stronger ones is that estrogen, which is a hormone that protects our joints, it falls during menopause. And many experts strongly believe that this drop is what's causing the joint pain and inflammation. But here's the catch. While we do see this clear connection between joint pain and menopause, what's the other thing that's going along during the same time? We're getting older, and we tend to get more joint problems as we get older. So proving that it's only estrogen which is leading to this joint pain is a little bit tricky. That said, I do have a patient who has rheumatoid arthritis, and her medications were working pretty well in the beginning. But then they weren't working as well anymore. And she had been talking to her primary care team, and they were thinking about doing hormone replacement therapy. So she decided, let's go ahead and do it. And when I saw her, she was sitting actually in the infusion center, getting an infusion of her medication, her rheumatoid arthritis medication. And she's like, Doc, I can't tell you, all my joint pain has gone away. And I started this hormone replacement therapy. Now I do not have any pain anymore. Does this mean I even have rheumatoid arthritis? In her case, she does have RA. Everything supports it. But yes, there was also a component of joint pain from the hormones, since taking that HRT really took care of her symptoms. So there are lots of different causes of joint pain, and you kind of have to tease them out with the help of your practitioner. Before we get into what's normal and what's not normal with joint pain, let's clear up some common myths. First, it's just aging. Many women are told this, but if that timeline kind of matches up to when you're going through perimenopause or menopause, that could be part of the issue. Second, joint pain isn't related to hormones. We know now that estrogen does affect joint tissues directly. And finally, if your labs are normal, it can't be rheumatoid arthritis. Well, that's not true, because there are quite a lot of people with rheumatoid arthritis that have completely normal blood markers, and yet they still have the condition. So it might be still something worth checking depending on your symptoms. Here's why we strongly suspect estrogen's role. Joints contain estrogen receptors in ligaments, bone, and cartilage. Estrogen reduces inflammation, so lower levels of it could lead to inflammation and painful joints. It also supports cartilage and bone health, so lower levels of estrogen could directly impact joint tissues. Estrogen receptors are found in nearly every part of the joint, whether it's bone, ligaments, cartilage, or synovial lining. This tells us that estrogen probably plays an active role in joint health, not just bone density, which is what most people assume. But studies that are exploring hormone replacement therapy, HRT, are giving mixed results. One of the largest ones is the Women's Health Initiative, and they found modest improvement when they gave estrogen therapy. But the other studies were less convincing. Interestingly, if you've ever heard of medications called aromatase inhibitors, if you've had breast cancer or know somebody else who has, they're the medication that you often take for several years, 5 years, 10 years after you go through active treatment. And it's to prevent breast cancer from reoccurring. Well, when you take those pills, they block estrogen. And a lot of times, one of the side effects is joint pain, which further supports the hormonal connection. Even large studies like the WHI only showed modest improvements in joint pain. That's why the joint pain from menopause is often considered multifactorial. Whether it's hormones, aging, inflammation, or stress playing a role, there are so many different reasons that you could be getting it. I had another patient in follow-up 3 weeks ago, and her doctor had sent her over because she had an abnormal blood test, thinking that she could maybe have something like lupus. It didn't really match up in terms of her symptoms and the blood marker, and I wasn't really sure she had an autoimmune disease. She was 48 years old, and she had been discussing with her GYN doctor in terms of starting hormone replacement therapy. She was also having other symptoms, some hot flashes, some mood changes, and they were considering it. So when I met her, I told her, well, why don't you go ahead and try it if you want? You'll know pretty soon if it's working for you or not. And when I saw her a few weeks ago, she's like, it really helped. She's like, my joint pain symptoms are completely gone. I mean, occasionally I get an ache here and there, but not like it used to be. And this made much more sense to me than her having an autoimmune disease. This won't work for everyone. People have different reasons for joint pain, but there are some that could benefit from treatment with HRT. Everyone is individual. It's worth looking into if your pain starts right around that time, and especially if it's associated with other different perimenopausal or menopausal symptoms. Okay, so in terms of what's normal, unfortunately, some joint symptoms of menopause could be normal. If you have some mild joint pain or stiffness, especially in the morning or after you've been sitting around for a while, being sedentary, or you could have temporary joint pain just by the weather. I know on certain weeks when it's like hurricane season here or there's a weather front that's really bad, everybody that week is going to be complaining about their joint pain. It can happen. Or sometimes you get joint pain with overuse. But again, all of these joint pains should be going away. You could be even getting some stiffness. However, it should be relieved pretty quickly if you're moving around. What should you be worried about? What are those red flags? If you're having persistent redness or swelling in your joints, usually single joints, it's not gonna be the whole hand, but it could be specific joints. And if it happens, take a picture, because a lot of times you won't be seeing the rheumatologist for several weeks or even months, and things might be gone by the time you see them. But pictures really help. My patients bring them into me, and oftentimes it really helps with the diagnosis. If you're having severe morning stiffness, which is lasting more than a half an hour, you just can't get out of bed, you feel like you're the Tin Man, that's a warning sign. If there's pain affecting both sides of your body symmetrically, because rheumatoid arthritis is more of a symmetrical condition, and we have different types of arthritis, inflammation in the body, it could be asymmetrical, but again, if there are things that are just not making sense, one area is really inflamed, red, hot, swollen, tender, that's possibly a warning sign. Or if you're losing weight, you're really fatigued and tired all the time, and it just doesn't make sense in proportion to all the activities that you're doing, that could be another warning sign too. And if you have any of these warning signs, you need to go in and see your practitioner, because you should be getting a full physical exam, seeing what exactly is the problem. Is it tendons, joints, ligaments? They would do blood markers to see how your inflammation is, and maybe even getting imaging studies like x-rays or even an MRI, depending on where the issue is, because early diagnosis is really key in these conditions. If we catch it early, we can treat it early. Maybe you won't need as much treatment or as strong a treatment. If you get into remission earlier, hopefully you won't have joint damage in the future, and overall it can really improve your quality of life. So what are some quick tips for relief? For everyday aches, simple strategies can help. Gentle stretching or even yoga. Just moving. Moving is one of the most important things that you can do if you have joint pain. And it can help so many different things. Now they're finding that maybe it helps prevent dementia. Certainly good if you're at high risk for heart disease, stroke risk, so many different things. Hydration, very important to stay hydrated. A lot of people are not doing this. And you also want to look at your food. Anti-inflammatory foods like berries, leafy greens, nuts, certain vegetables. I have a lot of videos on that, and you can take a look at those. And having quality sleep. It's not just enough to sleep. You have to have good quality, restorative sleep, restful sleep. Otherwise, if you're just tossing and turning and you're not feeling rested, it's not good sleep. And you have to find out what the reason is for that. De-stressing. I can't say this enough. Stress absolutely can trigger so many things. So don't be socially isolated. Find activities to help improve your mood, whether it's dancing, reading a book, going for a walk with your friends. It doesn't matter. Whatever helps you de-stress and works for you is the best thing for you. I'll share more in-depth treatment and tricks in my next video, so make sure you follow for that. If you're feeling confused, you're not alone. Joint pain in perimenopause and menopause is incredibly common, but it's also something that we can figure out and hopefully treat. Awareness, though, is the first step. I hope this clears up some confusion around menopause-related joint pain. If you found this helpful, please follow and share with somebody else who might. And let me know in the comments what joint symptoms have been affecting you the most during menopause or perimenopause. Until next time, I'm Dr. B with Plant Forward MD. Follow for more tips on your health.